If you're worried about your lower back pain, then this video is definitely for you. I'm going to give you the only 3 exercises you will ever need to improve the flexibility of your lower back and therefore reduce your pain. And you can do these exercises in as many variations as you wish. Before that though, I'm going to talk to you a little bit about back pain because the stats are very worrying. In 2025, you can no longer afford to ignore your back pain, even if it only just started. Make sure you watch this video till the very end. Hey everyone, my name is Joy Agude. I'm a chartered physiotherapist and the proud founder of The London Physio. And we are a virtual physiotherapy service that you can tap into from anywhere in the country. So if you need physiotherapy for your back pain or anything else, then definitely reach out. It's all the w's.thelondonphysio.co.uk. It takes just 2 minutes to book an appointment. In today's video, we're going to be talking about non-specific lower back pain, the kind of back pain where you don't have a diagnosis. These are the kinds of back pain that you just get almost sort of out of nowhere. And sometimes they can really linger. The good news is the sooner you understand how back pain works, the sooner you can deal with your back pain before it becomes chronic. And by chronic, I mean anything over 3 months. You might have heard the terms acute, subacute, chronic. Acute essentially means anything that started less than 6 weeks ago. Subacute means anything between 6 weeks and 12 weeks, which is 3 months. And then chronic essentially means 3 months onwards. Now, the reason why you should understand this is because once you start getting to the chronic stage, your pain changes as time goes on. The body does this amazing thing called compensation, which basically means that you start to accommodate the pain, you start to walk a bit differently, sleep a bit differently. It goes from non-specific back pain to potentially sciatica or to something else. So if you understand how this works from the beginning, you can really avoid getting to the stage where it becomes something more serious. Especially as pain is not only physical, pain is biopsychosocial. There are a lot of psychological things that happen when you have pain. Sometimes people avoid certain types of movements. Sometimes people become isolated because they can't go out anymore, because they can't stand for ages with their friends at the bar. It starts to affect your sleep. Pain can lead to anxiety and depression. It can also lead to disability. So it's super important to not ignore your pain, even if it's less than 6 weeks old. So essentially, even if it's acute. So let's talk about some stats. Lower back pain is super common. About 80% of adults in their lifetime will have lower back pain. That's a whole lot of people. Lower back pain can also lead to disability, and we're talking about 12% of people here, which is a significant amount. When you think about the fact that 90% of the lower back pain cases that we see in primary care is actually non-specific lower back pain. So it's usually nothing serious, but it can eventually lead to a disability. I'm not giving you these stats to worry you. I'm giving you these stats to understand what the process can look like and what it realistically looks like for a lot of people. But also to say that you don't have to be one of those people if you're in the early stages. Even if you've had non-specific lower back pain for a while, you're still not at the point where you've got a diagnosis. So there's a whole bunch of things that you can do to help self-manage your pain and hopefully get it better. If you're listening to this and you're thinking, oh my goodness, I don't really know if my lower back pain is non-specific, this is the best place to start. Number 1, have you been given a specific diagnosis by a medical professional? And by that, I mean a chartered physiotherapist, a doctor, for example. Have you been told that you have anything like sciatica or a fracture, osteoporosis that is causing your back pain, ankylosing spondylitis, a slipped disc, which is actually a bulging disc? If you've been told that you have X, then it's no longer non-specific lower back pain. It is a specific diagnosis or a specific condition. So be careful to follow their advice or their guideline on exactly what you should be doing to help with that specific condition. And just bear in mind that some of the exercises that work for some conditions would not necessarily work for others. So that eliminates a whole bunch of people. But if you're in the second category, which is I haven't seen a medical professional, but I still don't know if it is non-specific or specific, then if you're worried about your lower back pain, you should definitely see a medical professional. Start with a chartered physiotherapist. We can assess your lower back pain, even virtually, and in most cases, give you a firm diagnosis. We have to go through a whole bunch of questions with you about red flags. So things like, do you get pins and needles in both legs at the same time? Do you have night pain? Are you losing weight and you can't really explain why that's going on? Some of the things you tell us and some of the things we see in your assessment when we get you to do different movements and how we're able to recreate your pain, those things can pretty much lead us to a diagnosis. However, like I said, 90% of cases that we see in primary care are actually non-specific lower back pain, which in itself may be your diagnosis. If you fall into this category, then this video is definitely for you because these set of exercises will do you a whole world of good. Before we jump right in though, I do want to remind you that there's a whole lot more that your lower back needs. For example, your lower back needs strengthening exercises, good sleep. You need to make sure you're sleeping for long enough, you're getting good quality sleep, you're sleeping in the correct positions. You also need to make sure that your lifestyle matches all the good stuff. If you play tennis, if you do aerobics, if you love walking, swimming, whatever it is, your lower back loves movement. It loves a good lifestyle. Also, if you're in a lot of pain, make sure you are taking some pain medication and the right kind of medication, whether it's analgesia or anti-inflammatories. Speak to your pharmacist or your doctor about that. Because yes, the pain meds don't solve the problem, but they will reduce the intensity of the pain and give you a window of opportunity to do your exercises or do all these lifestyle activities that would actually help with your lower back pain. And finally, just to remind you that if you're stressed about anything, that could add a lot to your lower back pain. Even just the fact that you're tensing your muscles and holding yourself in, you're always on the defense, your muscles, your joints are all, it really makes a difference. So I say all this to remind you that these flexibility exercises, as amazing and important as they are, they only cover the flexibility aspect. There is so much else that your back will thank you for. Okay, so we're on the floor. I've got my mat out, but essentially you need to go on your knees for this one. So I'm going to go on both knees. Exercise number one is a pelvic tilt. If you're someone who struggles with your knees, you don't actually have to be on the floor for this. You can do this laying down. You kind of want your knees to be sort of hip distance apart. You want your shoulder, elbow, and wrist in line. It doesn't have to be perfect, but as long as it's not all the way out here, you know what I mean? It's kind of like the cat camel or the cat cow, but with that, you're focusing a lot more on your thoracic spine, although it still moves your lower back. But if you really want to target your lower back, try and keep the upper back, the upper bit of the spine, steady. And then what you want to do is you want to move just the lower back. You want to tilt the pelvis forwards, which gives you extension in your spine. And then you want to tilt the pelvis backwards. So it's this forward tilt and backward tilt. Forward tilt and backward tilt. Meanwhile, everything that's happening up here in your upper body is pretty much non-existent. So you're just going with the tilt back and forth and back and forth. So like I said, you can also do this laying down. So if you're someone who can't get on your knees, I'll definitely advise doing this laying down. Also, first thing in the mornings, because you're in bed, you know, before you get out of bed, this is a really good one that you can do laying in bed, okay? It's the same exercise, just a different variation of. So you're laying down, and essentially what you want to do is tilt the pelvis back by flattening your back. So the small of your back, you want to push that into the floor or into the bed, and then you want to tilt up to kind of take it away. So the small of your back, push it into the floor and then lift up from the floor. Push into the floor, lift up from the floor. Push into the floor, lift up from the floor. I personally don't like that variation. I really enjoy doing it on my knees. Obviously, the older we get, the harder it is to get on your knees, so it can feel very difficult to do that. You can also do it sitting down, to be honest. You can do it sat on a chair and just do the pelvic tilt back and forth and back and forth. It's the same thing. So I'm teaching you to fish here rather than giving you a fish. You just need to figure out the movements that your back can do. So the flexion and extension, and you can do 1,000 variations. You can do it sitting, you can do it standing, you can do it lying, you can do all sorts. And when it comes to pelvic tilts, you can really do them in all of those positions. For exercise number 2, the second movement your back is able to do is what we call rotation. So rotation is something that can happen in the neck. It can happen in your upper back, sitting and twisting. I did a video recently about exercises you can do sitting in a chair, and that was one of them, the rotation. But you really target your thoracic spine and you target your neck. If you really want to target your lower back, then you want to be laying down, because what you're going to do is use the weight of your legs to mobilize the lower back. So for that, I'm going to go back into my lying position. Keep your knees together and you want to keep your feet together. If you have space, then you can put your arms out. And this is another one that you can really do in bed. So you use the weight of your legs to pull on your spine. That is how you feel it in your lower back. Now, for some people, if you're really stiff, you may only get to about here, and that's totally fine. Just go as far as you can and then go back. And for others, you might find that you're able to get as far on one side, but then you may only be able to get to sort of half on the other side. That's just the way your back is working. That's totally fine. You know, maybe your pain is on the right side, so you can only go down that way a little bit. You know, however it presents itself, don't worry, just do what you can. But the goal is that the knees are together and you want to go all the way down to the floor. Also, with this, I want you to make sure that you are just relaxing as much as you can and letting the weight of your leg do the work, as opposed to actively using your core muscles to control the movement. One of the reasons why people get non-specific lower back pain is stiffness. So if you're actively squeezing those muscles and really using those muscles to help control the movement, you kind of defeat the purpose a little bit. You know, we want you to be as mobile as possible, as flexible as possible. And the other thing is, say for example, I'm going that way and my arm lifts up, then stiffness may be your problem, because what's happening is you don't have that rotation in the spine. So instead, your body is trying to come along with you. So you want to make sure that arm stays down and you rotate as far as you can. Now, if you're somebody who can come all the way down, then what you also can do is take that top leg and drop it down even further. So you get even more of a stretch at the top there. Well done. So we've done flexion and extension, which is the pelvic tilting back and forth. We have done rotation, as you know, and then now we're about to do what we call side flexion, or sometimes people may call it lateral flexion. So essentially it's bending to the side. So the first one was going forwards and back. The other one was going rotation sideways. And then this is bending to the side. So you can do that in as many ways as possible. But I wouldn't advise laying down or standing up for different reasons. Most of the time, if you're stiff in your lower back, what you'll find is that people will slide using their upper body, or they'll bend at the hip. The lower back kind of just gets missed. So this is what I would say, that you should definitely be sitting for this exercise. You could be sitting in a chair or you could be sitting on the floor. If you're sitting on the chair, that's fine actually. It's just as effective. The reason is because now your pelvis is stable, so your lower body can't help, your hip can't help. Let's get into it. If you're in this position, cross-legged as I am, you can put your hand down to sort of help you. And essentially you just want to keep that pelvis down on the mat that you're sitting on or on the floor, and you want to bend sideways. Try not to bend forwards or backwards. Keep this as a sideways movement. Now this arm is helping me do different things. It's helping me know that I'm bending to the side. That's number one, because the direction of the arm tells me, but also the weight of the arm is helping separate, just create that flexibility in my lower back. So feel free to lift your arm up and just take it to the side. And then for you, if you want to kind of just stay there a little bit just to make sure you've got to the end of range, that's fine, but you don't need to hold it like a stretch. I've designed these to be more flexibility, mobility rather than stretches. Well done! We have gotten to the end of these exercises. Remember, they are flexibility exercises to help you improve the flexibility and the mobility of your lower back. There's so much more, like I said before. There's still the strength aspect of it. There's the lifestyle changes. There's the pharmaceutical management, the pain medication, and all sorts. But you have completed the very basic now in terms of understanding how your lower back works, especially if you fall into that 90% of people that have non-specific lower back pain. If you know anyone that has lower back pain, share this video with them. Even if you don't have non-specific lower back pain. So what I mean is, if you have a diagnosis or you want a diagnosis because you feel that your pain is more specific, like you might have sciatica or something else, then see a physio, see a professional. We have a physiotherapy service that you can tap into. It's all the w's.thelondonphysio.co.uk. So if you need some help with your lower back pain, even if it's just a little bit of guidance and you need an exercise library put together for you for the flexibility aspect, for the strengthening, and just general lifestyle advice that is tailored to you, then definitely see a physio and we'll be more than happy to help you. Tap in. That's what we're here for. Tap in. Until next time, look after yourselves and each other.